And without further ado, let's jump to our first speaker, Andelyn Russell. She is a PhD candidate at the Wharton School, University of Pennsylvania. She will talk about the Buddy System, which is a research study being conducted in collaboration with Good Business Lab. And it seeks to implore the impact of reducing loneliness among female migrant workers. Off to Andy.
Thank you, Mansi. So next slide. Okay, to start, what is Buddy System? As mentioned, it's a research study that seeks to answer what is the impact of reducing loneliness among female migrant workers. This is a pretty specific question, so I want to describe the parts of what that means. Next slide. First, why are we studying loneliness? Loneliness is a key issue for several reasons that are often clouded with misperceptions. A lot of times when people think of loneliness, it's common to associate the issue with the elderly in developed countries. Although there is a lack of awareness about mental health issues in general.
Public policy.
Sorry,
No.
Andelyn. Mansi, could you mute?
और ये recording का क्या मतलब आ रहा है? वो record हो रहा है साथ में. मेरे मोबाइल में. अरे आपने front camera.
We just gotta,
Sorry, I will.
Front camera on नहीं. अच्छा नहीं ये तो हाँ. अच्छा अब ये तो ठीक है. अब आप तीनों एक दूसरे.
Sorry for that, guys. Andy, if you can continue, please.
Sure. I was still on the previous slide talking about loneliness. There we go. So when people think of loneliness, as mentioned, it's common to associate the issue with the elderly in the developed countries, which is a misperception that, you know, number one, it's a global phenomenon, but it also is an issue in the specific study context. We're looking to launch the study do experience high rates of loneliness. Research has suggested that it's just as common among the young too. Prolonged loneliness can have serious consequences. Can you please go back to, I'm still describing the loneliness. Oh yeah, thank you. So I just wanted to point out why loneliness is really important to study, because of this really serious impacts, like disrupted sleep patterns, cognitive function, altered immune system that, you know, people aren't aware of. A lot of times when you think of mental health issues, you know, depression and anxiety, those are at the forefront of your mind. But then, you know, loneliness, it's less known, but also very important as well. So with such negative impacts, it's clear that reducing loneliness could have large impacts on personal well-being. The next slide. Okay, and next, why is it important to study loneliness among migrants? As mentioned, the young are already susceptible to loneliness, but migrants even more so because they are separated from their family, friends, and social support systems. The migrants that we're looking to enroll in the Buddy System research study are female garment workers, often from rural areas in other states in India, such as Orissa, Jharkhand, and Chhattisgarh. This is often the first time they've worked outside their homes and even been outside their villages. Their villages have tight-knit social networks that they're leaving for the first time, and being from other states, they likely don't speak the local language in Bangalore. In scoping for Buddy System, we talked with several workers who seriously missed their family and friends, and they hadn't had the chance yet to make new friends at the factories in Bangalore. This emotional pressure can be too much, which causes the migrant to decide to return home. Returning home can have really large consequences for the migrants because they're able to make a much higher income at the factories than they are in their villages. And this income, it can be used to provide a safety net to their families to improve not only the migrants' health and economic stability, but that of their extended families as well. Okay, next slide. So the next point is, why are we focusing on workers? That is because, as described and is like the mission of Good Business Lab, there's an opportunity for a virtuous cycle. So as mentioned, loneliness is very common and it can have serious consequences. But then if workers aren't in good health, it can hurt their productivity too. Firms may not realize the impact of loneliness and their opportunity to approach this issue in a cost-effective way. Thus, reducing loneliness among migrant workers can improve both the well-being of workers and the bottom line for firms. Next slide. I'll now describe the specifics of the study design. To answer the question, what is the impact of reducing loneliness among female migrant workers, we're conducting a randomized control trial. That's a study design in which we enroll a group of female migrant workers at the Shahi factories in Bangalore and randomly assign them to either the treatment group or the control group. The control group, they're going to continue living their lives, and we're going to collect information from them, which I'll describe a little bit. Those are our outcome measures. But then the treatment group, they'll participate in a program to reduce loneliness. This program is called the Buddy System, and hence the name of the research study. And what the program is when new migrants come to the factory and agree to participate in the study, if they're randomized to the treatment group, they'll be paired with a worker who has been at the factory for at least 7 months. The new worker, they're the junior, and the worker who's been at the factory for 7 months is the senior. We're then going to instruct them to meet for 45 minutes twice a week for 8 weeks. And there's going to be 3 possible instructions that we're going to give them. These are our 3 treatment arms among the treated workers. So the first is just instructing the pair to really spend time together. This is providing a link. The next treatment arm is we're instructing the senior to provide cognitive behavioral therapy to the junior. So what is cognitive behavioral therapy? Well, I should say it's a treatment informed by cognitive behavioral therapy. Essentially, studies have shown that loneliness, it can cause a mental trap in which somebody who is lonely, they can perceive the world more negatively. So we're going to provide coaching to the senior in order to help their junior break free of those negative mental traps by walking them through situations and how they can. The third treatment arm is combining the other 2. So first, just having the junior and the senior become friends, and then also having the senior coach the junior on how their negative perceptions may be increasing their loneliness. Okay, so next slide. I'll then talk about our outcome measures. So in order to determine the impact of this intervention on loneliness, we're going to be conducting surveys to measure loneliness. We're using the UCLA loneliness scale. So these are administered to all the juniors and the seniors who are in the control group, in which there's no program administered, but then also the treatment group in which the program is administered. We're also going to be conducting a depression scale, and that's to, of course, measure the levels of depression experienced by both the juniors and the seniors. Then physical health and well-being. So this is measuring whether the workers felt ill, if they spent money on medical expenditures. Then we're going to administer questions on female empowerment. So by reducing loneliness, can this intervention also cause both the junior and the senior to really feel empowered to take a more active role in deciding their futures. Oh, if you could go Go back a slide, please. Oh. Okay. Then I wanted to discuss the social network survey. So not only are we looking for the impact of the program on the juniors and the seniors who are in the treatment and the control group, we want to see what the spillover impact is among the whole network of people at the factory. So if a junior comes to the factory and is feeling really lonely, but their connection with the senior helps them feel less lonely, what is the impact on the friends of the senior? Can positive mental health extend through a network? And that's what our social network survey will help determine. And then we're also going to be collecting data on attrition, absenteeism, punctuality, promotions, productivity, and skill grading. These are the factory administrative outcomes. Okay, and the current status is that we're looking to launch a small-scale pilot soon, and that the larger study, which will involve 2,000 pairs of workers, we're hoping to launch next year. So thank you. And
Thank you, Andy. Thank you so much. Sorry, we were facing a bit of technical difficulties. And thank you so much, Andy. You took it off really well despite all of that. Before I open the floor for questions, I just want to know from my colleagues if you can see the current screen.
Yes, yes, we can.
Okay, sorry for the confusion, guys. We have actually received an overwhelming response, and it's affecting the server a little bit, but I see two people have raised their hands, Arvind and Gauri. So I will open the floor for questions now. Andy, would you prefer taking both the questions together or one by one?
It's one by one.
Okay, perfect. So Arvind, if you can go first.
Hey Mansi, I raised that hand when we were testing.
Oh, okay.
Oh yeah, I'm sorry for that.
That's okay.
Yeah.
Okay, so I would like to open the floor. Does anyone have any questions for Andy?
Hello.
Hello.
Do you have a hello?
Yes, we can hear you.
Yeah. Thank you, Andy, for this presentation. My name is Rafael. I'm a research associate at GBL, and I was wondering whether you had any ideas as of how it could be useful for other industries, for instance, and how it could apply for other industries.
Oh, sure. So essentially, this program is super flexible. As mentioned, we're just pairing a new migrant worker with one who has been at the factory for a longer time, 7 months in our case. So that can be applied, not just at factories, but other workplaces. So offices, but then universities too. And that's the beauty of it, is that our results can really be extended in a very easy way.
Okay, does that address your question, Rafael?
It does. Thank you very much.
Great, thank you. I think Anahita had raised her hand. Anahita, you there?
Yeah. Hi. So I work as a research associate at JPAL South Asia, and I had a question about the PHQ-8 survey that you use. So we're actually kind of in the process of designing a survey on a study on depression, and I was just wondering why you chose to use PHQ-8, because the standard module is PHQ-9. So I'm just curious what the modification is and why it was made.
Yeah, so that's an internal revenue board requirement. So our study, it had to be approved by the sorry, not revenue board, the internal review board of the University of Pennsylvania for research ethics. And so the PHQ-9, that's the same as the PHQ-8, except the last question is about suicidal ideation. And so, literally, we are not approved to directly ask about suicidal ideation. However, in the study design, we are coaching the seniors to alert study staff, and we are also monitoring responses of the PHQ-8, such that if study participants are experiencing intense depression, that they will be referred to psychologists and other professionals. Does that answer your question?
Yes, thank you so much. Thank you.
Okay, awesome. Thanks, Andy. That was beautifully answered.